Go. All right, we are live here. Everybody, welcome Dr. Ian Shtulman. Woo! He's been generous enough to give us some time today. He is a second-generation chiropractor working out in Palm Beach County, Florida at the Shtulman Family Chiropractic. He is a diplomate in chiropractic pediatrics, works with the International Chiropractic Pediatrics Association as a instructor, and you specialize with maternal and family health. You've been working with OBGYNs, pediatricians, midwives, and doulas all across this great world of ours. So I hope I didn't mess anything up. Did I get it all right? Did I get it all right?
Yeah, I mean, I would have just been good with Ian, but yeah, that works too.
That's pretty good. That's awesome. Well, that's a great thing, man. So thank you for coming on the show. We saw you at Life University speak, and your message is just incredible. The things that you're helping with creating chiropractic before. You know, my uncle is a chiropractor, Dr. Fred DiDomenico, and I was a breech baby, and he adjusted me in my mom's womb, or adjusted my mom with the Webster technique and flipped me on the table. So, you know, in this legacy, Bella, her parents are chiropractors as well. So it's cool to just be with you on the mission to creating this as like the standard in medicine and chiropractic, you know?
It's awesome. I love it.
Yeah. So we'd love to know more of like, how can we start to bridge the gap between parents and chiropractors who have no idea what's possible with chiropractic for mothers during pregnancy, after pregnancy? Like, where's the best place that you like to start?
Oh gosh, that's such an interesting conversation because the kind of spectrum of how chiropractors present chiropractic to the world is so wide. You know, you have some chiropractors who believe chiropractic should restrict itself to being a modality for the treatment of uncomplicated musculoskeletal pain and help pregnant women be more physically comfortable only when they're experiencing some sort of muscle, discomfort. And then you have chiropractors who recognize that independent of whether somebody is in pain, if their spine and nervous system are not working well together, they're going to be less capable of adapting to the world around them, and they'll be less able to create the perfect internal environment for baby to grow, and they'll be less prepared for birth. And their transition into motherhood will be more challenging, and they'll have a harder time connecting with baby and healing and being the best, most complete and loving parent that they could be. Right. And so there's such a spectrum of what chiropractic can offer. And I think, for the chiropractic students that are listening, is you need to take that time to get clear on what chiropractic is for you, on what you understand chiropractic to be. Because, we have so much that we can offer, and it's going to be really hard for us to offer on like a large scale process unless we get clear on what it is that we do as a profession. So yeah, it's, I feel like it's such a loaded question because in many ways we're such a confused profession in terms of what we do. And I apologize, my dog is in the background.
No, it's perfect. It's perfect. Family chiropractic, right? The whole family. Yeah.
So
okay.
yes. So I mean, it's hard to say, to be honest, because yes, can we help expectant moms be more physically comfortable and have a better quality of life in pregnancy? 100%. Can we also influence the internal environment in which baby is growing and developing? Absolutely. Can we help both mom and baby be better prepared for birth? Yes. Is being well adjusted going to support the transition from pregnancy into motherhood and make it easier for both mom and baby to heal and transition into that new life together? Yes. But uh, you know, how we do that is we have to get clear with ourselves as a profession first. And for the chiropractic students that are listening, like, this is the time to do it. Don't wait until you're out in practice. Don't wait until you've graduated. Don't wait until you have a patient in front of you. You've got to figure that out now, because your clarity and your confidence in what you offer the world is what people are going to be attracted to.
Mm-hmm. Totally. What are, like, can we bridge the gap and bring it back to the basics? Like, we know between each other, like, what the effect of chiropractic has for us as individuals. But what would be interesting to really go on a deep dive with is, like, what is happening when a mother is pregnant, let's say from conception to birth, for somebody who's a mother who is just going through this pregnancy, and, like, what would be the difference between that scenario and in the same timeline, but with a chiropractor like yourself?
Yeah. So first of all, like, let's just honor how incredible and amazing pregnancy and birth is. You have a half of a cell from a sperm meeting up with half of a cell from an egg to create one single human cell. And
Yeah.
from that cell, it divides to 2, divides to 4, divides to 8. And it continues to divide. And then the cells start to differentiating, forming the heart and the lungs and the fingers and the toes. And all of this happens without us knowing how to do it, right? For anybody who's pregnant and listening, you don't know how to grow a liver cell right now, right?
Yeah.
But your body knows how to do that without you ever having to go to school to know how to do it, or to even know what's happening in any given moment.
Right.
And that, from a chiropractic perspective, is something we refer to as innate intelligence. Innate intelligence is this idea that living things have an inborn wisdom, that this wisdom allows them to constantly experience and adapt to the world around them. And when you look at the process of going through pregnancy, growing this human being, being able to initiate labor and give birth to this baby, to be able to bring that baby to your chest, and that baby start inching towards the breast and finding the breast and start sucking and feeding without ever having to learn how to do it. When you see the totality of all of this, it's impossible to look at it and not acknowledge that innate intelligence, that wisdom. And as chiropractors, we recognize that the nervous system is the master control system, right? It's the part of the body that is responsible for coordinating all of the other functions. And if that nervous system is compromised in any way, right? We think about like that as, drugs or medication or alcohol as something that can inhibit or disrupt the nervous system, affecting our balance or our cognitive thought, or et cetera. But what we don't realize is that you could also have similar effects from trauma accumulating in the spine, causing restrictions in spinal bone motion, irritating the nervous system, making it so now the body has a harder time coordinating all the complexity involved. So really simply put, what chiropractic does is it focuses on the relationship between the spine and the nervous system. And if we can restore and maintain proper spinal function, it's going to allow the nervous system to better regulate and coordinate function with less interference to that innate intelligence, allowing everything that's happening in pregnancy and birth and postpartum to happen more appropriately. And so, yes, without a doubt, chiropractic helps expectant moms be more physically comfortable. It also helps them better adapt to stress and create a better internal environment for baby to grow. It helps encourage baby to get into a better position by correcting the alignment of the pelvis and allowing baby to get into a perfect position for birth. It allows the nervous system to regulate and coordinate the onset and progression of those contractions. It allows the pelvis to move and dance with baby as baby corkscrews through the birth canal. It allows the pelvic floor to stretch and open to allow baby to get out. And it's also the system that helps baby transition into this world, directing those early reflexes on how to feed, how to poop, how to sleep, how to do all of the things they need to do. So because chiropractic can influence the function of the nervous system, chiropractic has the potential to make all of those things better and easier for both mom and baby.
That's awesome. That's cool. So during pregnancy, I mean, what would be, you listed some of the common effects that could be changed, these neurological pieces of energy that may be constricted in some way. I mean, the reason that would happen is because you're carrying a large amount of weight in a place that typically you weren't before, right? I mean,
yeah, it's part of it. I mean, so think about it this way. Women during pregnancy, there are three major changes that don't really happen outside of any other stage of their life. The first is that most women on average will gain about 20 to 40 pounds. I've had some moms in my practice who have gained 80 pounds, right? This is just from the increase in fluid, the increase in, growing a human being, the placenta, all of the changes that the body has to go through to create an environment necessary for baby to grow. So right off the bat, you're talking about 20 to 40 pounds on average of increased stress on the joints of the spine and pelvis.
Right.
Then you think of the changes that happen as a result of our body changing, right? As the belly gets bigger, it causes the center of gravity to shift forward. So we end up compensating by leaning back, and we end up with that sway back or that arching back type of position. So now we have not just 20 to 40 pounds of increased pressure. We also are leaning back, putting more of that weight on those posterior joints in our pelvis. And then on top of that, the hormone changes that are preparing your body for birth, that are helping to stretch and unwind tension in the pelvis to allow baby more room. It takes away all of the stability that you previously had in your pelvis. So increased weight, postural compensations, and less stability make it so that pregnancy is kind of a perfect storm of what we refer to as subluxation, or this neurobiomechanical dysfunction that happens in the spine and the pelvis. And that doesn't even take into account the decades of accumulated trauma that most women bring into their pregnancies, right? Being a little girl, being pushed and pulled through the birth canal, learning to walk, falling on your butt, playing sports, sitting in school, all those little falls that you don't realize are affecting you. But now pregnancy is a time where you have to adapt to all of the changes. But because of the accumulated trauma, because of the additional changes that are happening in pregnancy, it makes it that much harder to adapt. And that's why all of a sudden, women come in complaining of aches and pains that they didn't have before. And it's often blamed on pregnancy, but it's not. It's not a pregnancy issue. It's a failure to adapt to the changes of pregnancy issue.
Well, right. And this is where you're going to say something?
Yeah, so I had a question. So in the conversation of innate intelligence, if the body is having this, well, from the understanding that the body does have this innate intelligence when growing a human life, why would this creation create disease or subluxation in a natural process?
Can I tell you, that is one of the most important questions in chiropractic philosophy, right? It is one of the questions that when I pose to students, they often just feel like they just got hit in the side of the head with a shovel. Because it is really one of the most important things to understand, right? Is this subluxation, right? This neurobiomechanical dysfunction. Is it an intelligent response to trauma, or is it a pathological process that chiropractors focus on correcting, right? That kind of question, I think, is at the root of chiropractic philosophy. And I'm going to share my interpretation, the way I view it. I'm going to give you a little analogy. You have beautiful hair, right? I imagine if you go into the bathroom and you put in either a straightener or a blow dryer, once in your life, you've plugged it in and you've gone to turn it on, and all of a sudden the power shuts off in the bathroom. Right? It's happened to us. So you flip a circuit, right? What's happening when that occurs is the circuit breaker is flipping a switch, cutting off power to that section of the house, because it's doing so to protect the system as a whole. Right? It identifies a temporary, overwhelming amount of force or stress that it can't handle by itself. And so it protects the system by shutting off power to that one area. And it's exactly what it should do in that moment, right? But if left uncorrected, if you don't flip the switch, if you don't address the underlying electrical imbalance, then that room now becomes no longer useful, right? You no longer are able to utilize those electrical outlets the way you should. So think about it from this context, is that every single day of your life, you are being bombarded with physical, chemical, and emotional stresses that are at times overwhelming your ability to adapt. And as an intelligent response, the body adopts a temporary defensive fight or flight protective system, right? You can say that it almost stores that pattern, walls it off, encapsulates it, traps it into the body in order to protect the system as a whole. Okay? Chiropractors need to adjust those areas when the body isn't correcting on its own, or when the body is continued to be bombarded with that stress and isn't able to dissipate that tension. So what we do with our analysis is we evaluate that neurostructural, neurospinal system to see where is there this trapped physiology, this defensive fight or flight protective mode, space. And how can we apply a gentle adjustment to facilitate the body's innate healing, to dissipate that tension and start to heal, right? How do we know to go to the circuit breaker, flip the switch, and restore power to that area so the system can work as a whole, right? That's the chiropractic analysis part of it. And so the body is intelligent and your body is making these corrections all of the time. The chiropractic part is what happens when that stress has overwhelmed your body and it's not able to make the correction. That's when we need an adjustment to help reawaken that healing and help facilitate the body's better adaptation going forward.
Yeah.
Does that make sense?
Yeah, absolutely.
Cool.
This is the thing for people. We got some people coming on now. We're live. We got 7 people coming on. So if you guys have questions for Dr. Shtulman, go ahead and put them in the comments, and we'll make sure that you guys can get your questions answered. But so this is the idea where our body protects itself. You see the older man or the older woman who has this forward head posture, or now you see children more with that because of technology. Or you see somebody in a car accident or a football player who maybe got tackled from the side. Their heads are just stuck left. And, we were talking with one of our professors, and I was trying to think of his name. But our body gets into this state where it protects itself to heal a joint or a ligament, and uses our muscles to create less flexibility so it has the time to heal. And a lot of times the adjustments are allowing those muscles to finally relax.
Well, it's so funny you say that, because I had somebody come into my office on Wednesday, and she was complaining because she a couple months earlier she had gone and gotten a massage for the first time. She was on vacation. She wanted to treat herself, and she got like a really nice deep tissue massage.
Yeah.
And she has been in spasm and chronic pain ever since. And she asked me, like, why would that happen if they're just releasing those muscles? You know, why would my body have that reaction? And this is actually something that I see quite a bit in the office, is that when people are focused on the muscle tone, sometimes it kind of reveals underlying trauma. And the conversation I had with her was, well, what was that muscle spasm doing there in the first place? Right? Why was there something that the massage therapist felt the need to release in the first place? Because muscles don't do things on their own. They're kind of like the soldiers, right? They get instructions, they get directions, they get orders from the nervous system, and then they act out on those orders. And so if you have a muscle that's all of a sudden in spasm, or if you have muscles that are acting asymmetrically, or what we kind of interpret as inappropriately, we have to ask that question, well, why? What's the purpose of that being there? And in this particular patient's case, she had some sort of underlying injury, and that muscle tension was there to protect the system as a whole. And when she got the massage and it released that muscle tension without correcting the underlying trauma that the muscle was trying to defend and protect against, it revealed and caused all of these issues to start manifesting.
Absolutely.
And I think the thing to recognize is that, the difference between like a reductionistic versus a holistic philosophy is not separating the body into different systems, but recognizing that they're all working together, right? The muscles don't act independent of the nervous system, right? Everything's connected. And so the job of the chiropractor, right, when we adjust somebody, it's to look at where is that, not the spine is stuck, not where the muscles are tight, but where is the nervous system being compromised from like spinal biomechanics? And how can we apply an adjustment to allow the nervous system its full capacity to regulate and coordinate function? And yes, sometimes those muscles will calm down and people will feel better. But sometimes we do that adjustment, releasing tension in the nervous system, and it starts to cause changes in the body. And sometimes you'll have new areas where the muscles will become active because you're kind of peeling off a layer of trauma, and then it's revealing like the next area that needs to be healed. That's why with chiropractic, you typically see a series of visits, because we're not trying to treat a problem. We're trying to unravel years, if not decades, of compensatory changes of being in this fight or flight state. And so I think that's one of the reasons why chiropractors should be less concerned with the day-to-day changes that they see in their patients, and be more focused on the overall course of care as they progress, because things should be changing and responding as that person, as that patient is changing and responding on the table over the course of time.
For sure. This is a cool segue into like our body, from my perception, and I'd love to understand your opinion, but from my perception, our body is pretty binary, where like as our cells replicate, they're replicating healthier or they're replicating weaker.
You're either moving in one direction towards health, or you're moving one direction towards sickness and disease and death.
Absolutely. So this is where it would be fun to get your take on what could be the possible differences, and maybe you can say or not say, I'm not sure the rules, but hey, you don't have to follow the rules. We could talk about our opinions, but the difference between a mother who's choosing to have chiropractic care, not only for herself during this entire process, but like how is the baby going to develop, and is there differences that you see in cognitive function or whatever? You're around this so much. What is it that you're seeing in your practice?
Oh gosh, this is such an interesting conversation. So there's two areas that I want to go with this.
Mm-hmm.
Number one is when I talk about health with my patients, I describe like 5 keys to health that in order to move towards the direction of healing and optimal function, you have to eat well, move well, think well, sleep well, and have a well-functioning nervous system to mediate all of it, right? The chiropractic portion of it is the nervous system, right? The other 4, the eat well, move well, think well, and sleep well, are your responsibility to take care of yourself and your lifestyle. The healthier you are pre-conception, the healthier of a pregnancy you're going to have. By the way, this is not just about the woman. Marcia Schaefer, who teaches for the ICPA, talks extensively on how the health of the father influences the health of the pregnancy, particularly the health of the placenta. When we think about morning sickness, when we think about early miscarriage, she attributes much of that to the health of the father.
What is the correlation between that? I'm curious.
Listen, I would say she'd probably be the next person to interview if you want to dive deep into this. But there's a whole process of what DNA or what part of the embryological process is formed from the sperm, so I'm going to leave that to her because she speaks on a level far beyond my understanding. But there's absolutely this connection between the father's health and the quality of the pregnancy as well. So it's not just a one thing. And I think too often we place all of the emphasis on mom, and that's not fair and it's not accurate. It really is like a relationship where both people have a participating role. We just think that because, dad's effort is done after, 3 minutes of work, rounding up, of course, that means that their job is done and now it's all on mom. And that's just not the case. Right. So there's something that's super important about being proactive in taking care of yourself and doing the, eating well, moving well, thinking well, sleeping well, and having a well-functioning nervous system and doing all of those things pre-conception. And then as you're going through pregnancy, the choices that you make to move in that direction of health not only create a better internal environment for baby and allow baby to develop more appropriately, but it also creates, even on a psychological level, a level of confidence, of certainty, of reassurance that I'm doing something that's positive. I'm doing something that's healthy. And that changes the environment from baby bathing in stress hormones the entire pregnancy versus baby bathing in a place of love and peace and connection and compassion. So there's multiple areas where I think those choices matter. Now, the other thing is there's something that's really exciting. It's called EPIC, and it stands for the epigenetic impact of childbirth. And what this essentially tells us is that, so there's this idea of, we're familiar with the idea of DNA or our genes, right? Well, the old model used to say your genes are your blueprint. That's it. That's what you're stuck with, right? Well, now the emerging science of epigenetics talks about how lifestyle or environmental factors can activate or deactivate the expression of genes, right? That you and your lifestyle actually have a sense of ownership over whether those genes are expressed. And I'll give you a great example of that. A few years ago, it was all over in the news, the BRCA mutation, right? The breast cancer gene, right? Which is how it was described. And they talked about 80% of women who have this BRCA mutation will develop breast cancer at some point in their life. And I always argued, then we should stop calling it a breast cancer gene. Because if it was a breast cancer gene, then 100% of people who had it would have breast cancer.
Yeah.
It's a predisposing to breast cancer, but then there's environmental or lifestyle factors that will turn on or off the expression of that gene.
Exactly. For sure.
Right. So the problem is that medicine never asks the question, well, what's different about those 20% of women who don't get breast cancer?
Yeah.
Like that makes it so that gene doesn't express itself.
I
Right.
got a good chiropractor. Just kidding.
Well, yeah. And listen, here's the thing is that like lifestyle matters. And in terms of the birth, this hypothesis, this epic hypothesis basically says that the birth experience is what primes the baby's epigenetic expression, that there's a Goldilocks zone of the ideal amount of stress that baby needs to experience in birth to activate their nervous system, to wake up their immune function, to activate their genes. And if they have too much stress from a really difficult pregnancy, a really stressful labor, or if they don't have enough stress because maybe they had a planned cesarean without any, course of active labor, that those two things will affect baby's epigenetic expression, and it basically primes their epigenetics for the rest of their life. And so birth matters. They actually talk about how the exposure to oxytocin and cortisol and epinephrine, right, these stress hormones, the exposure to that during birth is a vital priming agent for that child's epigenetic expression. And that the laboring of labor is important for how that child learns how to experience and adapt to the world around them. And I love that so much because, instead of thinking about birth as some burden, we think about it as a blessing that wakes baby up and helps get them ready to live in this world. And chiropractic can influence that, right? Chiropractic, by the nature of affecting the nervous system, by shifting women out of a fight or flight into more of a balanced autonomic state, by activating the vagal tone and increasing parasympathetic activity, can actually create a better environment, a less stressed out, a more adaptable, more resilient environment that affects not only baby's development, but helps set up for an easier, more appropriately stressful birth experience for baby. And so this isn't just about, kind of the one thing about how does this affect baby? This is about how this affects babies the rest of their life. And of course, listen, moms who are more comfortable and more relaxed and more adaptable during pregnancy tend to have babies that are more relaxed and more comfortable and more resilient. And so I usually find that the moms who have been under care in my practice prior to pregnancy, right? They've had care, from preconception throughout pregnancy and then postpartum. Their babies tend to be more comfortable, more relaxed, breastfeed more easily, go to the bathroom more comfortably, sleep longer. And the moms who come to me either really late in their pregnancy after struggling, or they come to me after birth because their baby is having a hard time transitioning, that it's harder to get them back to that space. So that's one of the reasons why I always encourage people, when you're planning for a family, it's more than just deciding to get on or off birth control. It's about what are you doing in your lifestyle for both partners to help set up the rest of that child's life.
Yeah. Yeah. Fascinating. I have a million questions, but I also love Bella is just always coming up with incredible questions. I want to give you space to ask some if you'd like.
No, well, I don't necessarily have an initial question for the moment, but I do just want to comment. I just took a personality psychology course at Life University, and it's so fascinating. Like the conversation has been like a debate in personality psychology. Like, is personality fixed? Is personality predominantly biological? Is personality predominantly situational? And the consensus currently is that it's a dial switch based on interaction between biological and situation and environment. And so just the way that interacts with chiropractic, the way that you're talking about it is like we have our nervous system, and when it's put in conditions of optimal state, then more optimal function happens. And so it's the same with personality, because none of the expression, emotion, feeling, body that we have is separate from the physical body. So I just like really love to hear about how you interact with it at the beginning of life, at such like a pivotal position for not just the physical body but the emotional body too.
Yeah, the conversation that I have with people, and this goes back. Are you familiar with? There's a poem from one of the, I believe it's from one of the Green Books. It's called "The Big Idea" by B.J. Palmer. Are you familiar with that concept?
I'm not.
Me neither.
Okay. So, it basically talks about, a man's walking on a sidewalk, and he slips on a patch of ice and he falls. And that fall is a small thing. And that fall causes a trauma to the spine, and that trauma is a small thing. That trauma causes a misalignment to one of the spinal vertebra, and that's a small thing. And it interferes with the nervous system, and that's a small thing. And that interference to their nervous system affects, them in their life, not just their physical quality of life, right? And how they feel, but it affects them on an emotional level and how they adapt to stress and their relationships. And it goes through this idea of, when that stuff happens, it matters to that person. But when you extrapolate that to an entire community, an entire country, the entire world, living through this filter of that accumulated trauma causing subluxation, interfering with their nervous system, creating this chronic level of stress and defensiveness and anxiety and fear, and how that influences not only people's quality of life, but their interaction with their family, their friends, the world, the decisions they make, how they respond to stresses or challenges. And that if you look at a lot of the idea of chiropractic, it's not that doing an adjustment is a big thing, because it's not. It's how that adjustment influences the way that person experiences and adapts to the world, and how that affects their relationships with their kids, how it affects their relationships with their spouses, how it affects the relationships in their community. And then you extrapolate that to, well, what if the entire world was well adjusted?
Right.
It creates a world where our leaders are not making decisions from fear and anxiety and stress and being threatened, but they're doing it from a place of, reassurance and confidence and compassion and love. And so it kind of presents this whole idea that, the big idea of chiropractic is not how can we help somebody feel better? It's how can we help the world heal when the world is no longer living in this subluxated, defensive, fight or flight state. And so I'll give you a really interesting example. I was about a year into practice, and I was taking care of this little boy. His name was Tommy, really sweet kid. And his mom decided that she wanted to get started and get adjusted. And she didn't have any real problems or symptoms or complaints, but she just figured, well, I'm bringing Tommy, I might as well, come in and get adjusted also. And so we do a series of visits, and we get to the reassessment, and we're doing everything. And she tells me, oh yeah, I'm sleeping better. Oh yeah, I have more energy. And I'm like, that's awesome. That's great. And I've just felt like she was holding something back. So I said, what's changed in your life that you haven't told me about yet? And I just kind of sat there in silence. And I could see her start to get
Flustered.
a little verklempt, right? She started to get choked up. And she said, I started liking my children more.
Oh.
And I thought to myself, like, well, how could an adjustment do that? And then you realize that if this mom was living in a subluxated state where she was doing the things that she needed to do, but she was doing it from a place of being overwhelmed, being stressed out, being anxious, being fearful, not adapting to the inevitable challenges of having, young kids, that's going to influence who's she able to be for those children, right? Her ability to enjoy them, not, take care of them, not love them, right? She did all those things, but able to enjoy being with them, right? Being able to love them and have fun with them and want to spend time with them beyond just the obligation of it. And when you think about not only how that affects mom's level of guilt, mom's level of certainty, mom's level of like joy and peace in being a parent, but how those kids now learn to experience the world and how they learn to love and how they learn to be in relationship with others. That to me is the big idea of chiropractic. BJ Palmer used to say that if the world was under chiropractic, we'd empty the prisons and we'd fill the churches. And he didn't mean literally everybody would suddenly go to church, but he meant that if the world was living in an unsubluxated place where their nervous system can effectively experience and respond to challenges without being overwhelmed, without being defensive, they make different decisions and they have different relationships and they make, choices for the world that are different. And that to me is the idea behind chiropractic, right? That's why I love this, because yes, it is absolutely great when you help somebody be more comfortable. Yes, it's great when you help them have a better birth. Yes, it's great when you help a kid who has chronic ear infections no longer have ear infections. All of that stuff is awesome. And I have thousands of stories like that. But when you extrapolate that to imagine what would be possible if everybody could benefit from that.
Yeah.
That to me is the thing that wakes me up, right? Or keeps me up at night. Like, how can I make that happen? That's what gets me out of bed in the morning. Like, how can I make that happen?
Well, I want to touch on this subject as well. We have chiropractors very high up with the Make America Healthy Again campaign. Dr. Dan Pompa, a couple people coming up in the ranks of chiropractors looking to help each other in at least our country, and to hopefully spread this worldwide. I mean, that's the whole point, is to make the world peaceful through nervous system. And what's cool about the story that you're talking about, there's a study that was just done that correlated headaches and chiropractic traction for neck traction and the relief of headaches and the symptoms. But what was fascinating about the study wasn't the fact that they showed that chiropractic care had a way higher success rate for eliminating the headaches compared to headache medication, which had virtually no effectiveness comparatively to chiropractic care. But what was an even greater result and unexpected was that the patient's perception of their emotional state had even higher effectiveness, than just the pain. Like, their perception of their emotional state was even a greater result than the fact that their headaches went away. This is amazing.
I'm gonna show you. I'm not familiar with that study, but I've got another one that I think is that represents this as well. And I think it's something that we need to talk more about, because this is it's from 2019. It's called Maternal Reports of Outcomes of Chiropractic Care for Infants. And essentially what they did was they took 1,000 infants and they put them under chiropractic care, and they handed out surveys to the moms to fill out before and after. And out of 1,000 mothers who completed the follow-up forms, there was statistically significant improvement across all aspects of reported behavior, from feeding, sleep, excessive crying, infant pain, cervical range of motion. And all of that's great. But the thing that I loved most is that by only adjusting the infant, maternal ratings of depression, anxiety, and satisfaction with motherhood demonstrated statistically significant improvement. And so that sort of thing is like, just by adjusting the child, you can influence mom's sense of satisfaction and anxiety and depression, in motherhood. That's the thing, is it's not about the symptom. And this kind of goes circle back to like our first conversation. Our first question is around philosophy.
Right.
If your philosophy within chiropractic is that chiropractic is a treatment for uncomplicated musculoskeletal pain, then you look at the people and you're like, oh yeah, well, if you have headaches, I can help you. Or if you have back pain, I can help you. Mm-hmm. But if you recognize that chiropractic has an influence on how the nervous system experiences and responds to the world, now all of a sudden you see these people in your life, maybe they don't have neck or back pain, but they're not sleeping as well as they should, or they're not handling stress as well as they should, or they're not able to adapt to the world as well as they should. Now all of a sudden, chiropractic has something to offer them. And too often our profession wants to pigeonhole or wants to like shrink what we do to fit within an allopathic paradigm of, treating sickness or disease. Instead, what we should do is recognize that chiropractic is not about treating sickness or disease. Chiropractic is about facilitating adaptation, right? So if you have medicine, which is the or medicine, which is the diagnosis and treatment of disease, and then you have chiropractic, which is focused more on the promotion, maintenance, and restoration of health. Those are two different things. And I think that's something that we can, use philosophy as a way of making that distinction.
Totally. I'm going to talk about my perception of what you're describing. This is what I do we have a business, and we help people create a new identity. It's actually not creating a new identity, but letting go of all the things that we've learned in the world and what to believe about ourselves. And this is what was so fascinating to me about your story, where the mother was saying, well, I started to like my kids again. What was going through my mind at this point, where it's like, man, chiropractic allows us to view ourselves without limitation. We're either going towards a state of health or a state of disease. Our brain works in parasympathetic, which is feeding, breathing, digesting, or a state of overwhelm, or just like our biological processes are stopping so we can survive, our state of survival. And when we're in a state of healing, then we tend to believe different things about ourselves. Our inner self-talk is different. And so for me, chiropractic is identity remembering. It's bringing back this sense of, oh no, I actually do have the power to do this. Like instead of I like my children, really maybe the underlying belief was I started to like myself again. And the byproduct is the connection with the children. Like having that study you mentioned about adjusting the infants, or it's like, well, if the mother is choosing to identify herself as a mother and the child is not responding well, then what is she telling herself that she is? Like, what kind of a mother is she saying that she is? That's the self-identity. And then that energy, like babies and children are so easily influenced by energy of adults. And so it's like really chiropractic for me is just like on along with all these points that you're bringing up in these biological processes, the connection with each other. It's just like chiropractic allows us to express our highest values, our highest beliefs about each other. For me, it's a connection to God in the spirit world. And it's just like, this is so cool. And why does nobody know about it? Like not nobody, but it seems like how has this been suppressed, or how has this been not just like going all over the world? And I think now we're starting to see this shift where after COVID, people's belief of their health and who they were and the powers that be in the systems are questioned. And now it's like, there's got to be something more. And this is really, to me, what we're doing in this moment, where we're creating it seems like it's a new identity, but it's born in us. We're just remembering who we are. And who we are is empowered. We're not this disempowered humanity, like technology keeps people in, and whatever is happening, I feel that
I think modern society, modern healthcare in particular, because medicine by its nature is the diagnosis and treatment of disease, which is good. It's a wonderful thing. If you have a disease, it should be treated. But when we hand the entire realm of health to a disease or sick treatment model, it positions everybody as some stage of disease, right? You're pre-diabetic, you're pre-hypertensive, you're pre-dead, right? Like this idea that we're going to view everything through the filter of what is wrong with you versus, hey, you're not a victim. Your health, your well-being is an expression of how well you're adapting to your lifestyle, right? Now, all of a sudden, it gives people not a victimhood around their health, but it gives them a level of accountability and responsibility. And when people make better choices, they feel better and they're able to kind of regain that power. And that's what I think is so important about this conversation, is that, chiropractic is one piece of the puzzle. But there are some people who have been told their entire life that their sickness is who they are. And I've seen people who on an emotional level are unwilling to heal because they're almost threatened that identity won't be there for them. Like
community in suffering.
Yeah. I mean, listen, I've had, you see this a lot, unfortunately, a lot with like the elderly population, is where they don't have anything else to do. So they spend their time going to the doctor, like that's their social time, is being in the doctor, and it's really unfortunate. I think part of that, has to do with, the loss of like local communities and the changes into like you mentioned, technology. But it's something that I think from chiropractic, when we boil down to it, boils down to connection within our own body, connection from, as BJ would say, man, the physical, and God, the spiritual, connection between the nervous system and every cell, tissue, organ, gland in the body, connection between how we experience and interact with our loved ones, connection among each other in our communities. And so connection is really such a beautiful word in the chiropractic world, because of that. And that's the idea, is that if you are better connected with yourself, with your spirit, with your innate intelligence, with your loved ones, your body, your body, your health, your quality of life is going to be better.
Absolutely. I mean, along with like the connection between the chiropractor and the patient and the families that are coming in. Like, I mean,
Yeah.
you know, there are patients, I've been at chiropractic offices that the patients drive 4 hours one way to come for this adjustment, but they're in wherever they are in the mountains or somewhere far, you know, and they've been doing it for 30 years. This Dr. Douglas D. Sienna, he's out in Newport Beach, California. There's somebody that lives way out in the mountains and nowhere. And every week he drives 4 hours in and out. And that's his only, you know, form of connection. He doesn't have a wife. He doesn't, I mean, that's his physical touch, you know, it's.
Yeah. I mean, Justin Ohm, who is the executive director of the ICPA, will, you know, we'll often talk about the most important thing that we do as chiropractors is be in relationship with people, right? Is help reassure them of their own humanity, their own dignity, their own intelligence, their own healing ability. And in many cases, we're the, you know, there are patients where we're the only people who actually like physically come in contact with them, the only ones who actually touch them. And there's something that's really healing about that. And it's, you know, when you think about the effects that has not just on their quality of life, but on their spiritual well-being, their emotional well-being, their relationships with others in the world as a whole, I think we have a really important value that we can add to the world because of that.
Absolutely. Absolutely. Well, now I have a question for Bella.
Okay.
All right. Because Bella's in her undergraduate right now, biopsychology.
Awesome.
Chiropractic school.
Yep.
Also, you know, we talk about having children of our own, you know, maybe not during chiropractic school, not the plan, but like
you make plans and God laughs. So
I know it's true. It's true. We're very aware of that. It'd be accepting if it happened, you know, but like, what do you think about in terms of you're in this place to be very well prepared to be a mother. You have this idea of health, and you're also wanting to provide this sort of knowledge for the people of the world. Like, are there any things that come up for you that you have questions to understand, or are there things that you're just like super thankful and excited for, or what are your thoughts on like moving forward in these ways in your life?
I mean, so much beauty, I think, just for women in general to no longer feel disempowered in their own health and in their own body. And I feel like so much of the experience as a woman is being told what's right and what's wrong for your own body. And I think the beautiful thing about remembering that you are whole and that we can actually heal each other, and we can heal ourselves even, like, is so exciting to bring to women and remind them that they are powerful beings, and that's not anything to be put away or ashamed of or something that is wrong. So, I mean, just like that innately is exciting to me, just seeing the women in my life go in and out of feeling that power, and being able to just be a facilitator of that remembering is so exciting to me. And then also, like, for myself to just continue to learn from doctors like you and from you so much, and like sort of like begin to continue to pull back the curtains a bit. I feel like a little explorer, and I'm very excited to continue to explore.
Yeah.
What
do you guys think if there was one message that would create the strongest impact for expecting families, Like what would be the hook that brings them into their chiropractor?
Are you asking me?
Yeah, well, open-ended, yes.
Wow, that's such an interesting question. I think the idea that always resonates with me is this idea that chiropractic allows you to express your full potential, right? That your kids are either you or your family, your kids, your loved ones are going about their life and are most likely not expressing that innate intelligence fully, not allowing themselves to fully experience and respond to the world around them. And if chiropractic can make that just a little bit easier for them, just a little bit, then it's going to have a big impact on not only who they are and how they can experience and enjoy life, but also how they can be a contribution to the life, to the world.
That's a good one. What about you, Bella? What do you think?
Could you repeat the question?
Yeah, the question would be like, what would be the one important message to convey to a family who is expecting a baby? Like, what's the one thing that would take somebody who isn't using chiropractic care? What's going to bring them to the chiropractor? Like, what's the one thing that you think would be so alluring for them to transition?
My first thought is like, what if it worked? Like, what if this is the thing that made your child healthy for the rest of their life? What if this is the thing that brought your entire family together? What if it really could change the health of yourself and your family for the rest of your life? If that's the possibility, why would you not try it?
Yeah. Amazing,
I like
right?
that. I mean, it reminds me of, what if you truly got everything that you wanted?
Right.
You
Yeah.
know?
Totally.
And you had help. You didn't have to do it all by yourself.
Yeah.
Yeah.
Like, what if all you had to do was show up and enjoy the process?
Yeah, exactly.
Somebody else had the answers for you. All you had to do was show up, and then that all just happened naturally. Like, that's amazing.
Yeah.
It's totally good.
What's your answer?
I feel like what would be, I try to think of what's the fear that family has. It's either a fear or an ignorance. Maybe if the family just has no idea, then that responsibility is on us as chiropractors to put that out there, which is the point of this the podcast, is the chiropractic message. So, I mean, if somebody is aware that chiropractic would exist, maybe they don't know. I think that right now there's probably a high percentage of people who just don't know. So then we go, okay, well, if people just don't know what's possible in chiropractic, then you go, well, what if you use chiropractic for a baby? They're going to take that thought and go, what do I know about a chiropractor? And there's going to be like a missing of the information. They don't understand that chiropractic, what it could do even just for outside of pain and injury. Like, they don't understand that chiropractic changes their nervous system. So like, hey, that study that you talked about where the mothers have a lower state of anxiety and depression just because their infant is experiencing that. Like, I love what you said about what if it works? You're like, yeah, okay, well, what if the generational patterns of health weren't coming from your genetics? What if the reason that there is scoliosis in your family? What if the reason that there's digestion problems? What if the reason that depression, anxiety, like heart problems, allergies, asthma? What if what if you had 5 miscarriages and that is tending to happen for generations, or you see this type of cancer? What if the reason for all of those problems was coming from the posture and the lack of energy going throughout your body because your spine is misaligned? You have a subluxation. And what if there was a way to measure that? If there was a way for us to take images of your body and just go, we can see exactly why that's happening. And the children are so perceptive of their mothers and their parents. You know, if mom and dad are walking because dad's got a short leg, you know, there's this cute little video of these little infants walking like grandma and grandpa, and they're walking around like walking with the same hobble as grandma and grandpa. And then they start to adopt these patterns, and no wonder why they have similar health problems. Now, it's not to say that every generational health problem has nothing to do with genetics, but a lot of them do, or with posture over genetics. So what if going to the chiropractor changed the health of your family for generations to come? What if you could affect generations up and down, living and not born yet? What if the investment of 3 to 6 months turned into a lifestyle that created health and prosperity for people you've never even met and maybe won't for the rest of your life? Like, what if it changed your lineage, the amount of wealth that you have, the amount of contribution you've given to the world? Like, what if chiropractic took you out of your brain and your mind and it feels like a prison? And what if you just showed up to the chiropractor and he or she essentially removes this burden and this like trap that we find ourselves in, and we just let it all go? And what if the chiropractor could help that identity and mindset be everywhere in your household? I mean, we adopt the ideologies of the people that we spend the most time with. So if the chiropractor helped everybody who lives in your house vibrate at this level, like, what would change in your life? What would change in your life if everybody in your household was dialed in and had confidence in their health? That like, hey, I was in 3 car accidents in like the past, in like a 2 or 3 month period. And I had x-rays because I had an incredible spine. Like, there was nothing that changed. What if
I think you've got the title for the podcast is what if?
Yeah.
It seems to be a good theme.
Yeah. Well, this is the thing, is that, that's the question that might draw them in for sure. But the reality is there's a mountain of peer-reviewed research, right, case studies, your experience as a chiropractor, just people that have this is real. It's just less common. Then you want to read, the what if in medicine as well. If you take this, then what if it causes depression? What if it causes suicidal ideations, even though it's supposed to make you happy? What if you stop sleeping well at night? What if you start having internal bleeding? Like, these are all the side effects of the medication. Like, the side effects of chiropractic are a better life. Like, it's nuts.
Yeah.
Yeah.
I mean, like it seems so simple when you understand. And I think the reason why, well, I should say, The reason why we should have hope as a profession is because, when you recognize that it's our own failing in how we've communicated what we do,
Yeah.
it gives us an opportunity to say, okay, now I can do something to change it.
Yeah.
People don't know because we have failed as a profession to communicate what we offer. And that's something that we have to get better at doing, because what ends up happening is you have one side of the profession that just kind of wants to pigeonhole us into like a medical subspecialty, and then you have another side that is talking more about like what we're talking about. And this gap is because of a failure to really understand what it is that we do, even within our own profession. And so it's something that chiropractic students, really need to dive into and explore this and get a better sense of what it is that we offer. Because otherwise we'll be asking the what if question forever.
Yeah. Totally.
Nothing's going to change if we don't change it ourselves.
Yeah, absolutely. Absolutely. Well, hey, I want to be respectful of your time. I know we've been on for about an hour and 10 minutes. We got 31 people. Y'all have been on this trip with us for nearly the whole hour. We had 15 in like 10 minutes. It's freaking awesome. So thank you guys for staying on for so long. I mean, if you've got to go, then absolutely we respect your time. But if you've got more time, then we can keep going.
I've got a few more minutes. My kids should be getting home from school soon, so I got a few more minutes. If there's either a question or a topic that either of you or one of the viewers want to bring up, I'm certainly happy to explore.
For sure.
Well, I have a question. How do you, as a chiropractor, within other chiropractors, like how do you facilitate the conversation of like creating that common ground or finding some understanding of what it is that is like the chiropractor?
Like, how do you bridge that gap in the spectrum of the profession?
Yeah.
So that's an interesting question. This weekend I was, earlier this week, I was having some conversations with schools that don't typically talk about this kind of side of chiropractic, right? They very much view chiropractic as like musculoskeletal, modality. And I think what I usually do is I just go back to the real basics, right? Do you recognize that trauma can cause abnormal biomechanics in the spine?
Right.
Yes. Okay. Cool. We agree on that. Do you recognize that the abnormal biomechanics in the spine can influence the nervous system? Whether you just view it as like, muscle spasm or weakness, or you recognize that it can also influence, like, you recognize that there's some influence between the spine and the nervous system.
Right, right.
Yeah. Cool. Explain to me how the autonomic nervous system works, right? Like you can't influence the nervous system and not affect, all of it in some way.
Yeah.
And so the problem that I think a lot of, the musculoskeletal chiropractic world sees is they think that we on this side are trying to claim that we treat maternal anxiety and maternal depression and, all of these, what ifs, right? They think that we're promoting chiropractic as a treatment for those conditions. Mm-hmm. And they don't recognize that what we're saying is that regardless of whether you have those conditions or not, your body is going to be better off if the spine and nervous system are working better together. And that we're not trying to treat a condition, but we're trying to facilitate better function and improve adaptability. Mm-hmm. And when I have that conversation, typically a lot of their guardedness, defensiveness seems to like go away. because it comes off as a much more nuanced and rational perspective.
Right.
Right.
And so I think, again, and a big part of the issue is how we've communicated, because, those of us in this side, if we communicate that, oh, chiropractic is going to, oh, if you have cancer, make sure you come in and get adjusted. We understand that the conversation among adaptability and immune regulation and stress and, that people with cancer will absolutely benefit from being well adjusted. But we present it in a way as we imply that, oh, if you have cancer, you should get adjusted because chiropractic is going to help treat it. And that's the area where I think it causes this side to just push away anything that we're talking about.
Right.
It's the lack of nuance. It's the way we try to water down our communication to fit within an allopathic paradigm that makes everything about health in relation to the treatment of disease or conditions.
Right.
That, if I ever ran for office, my tagline, my bumper sticker would be nuance matters.
Yeah.
Because when you really look at chiropractic in this nuanced way, you can see, yes, it helps people with musculoskeletal conditions, and having a properly functioning nervous system free of interference from spinal dysfunction is going to allow the body to work better and maintain a better quality of life. There's room for both. And, I think that lack of nuance in our communication is the thing that pushes one side away. And so, reflexively, they just, want to, anything that's not what they're doing, it just becomes, something that they're not connecting with. And I think it's because they just they've never heard the nuanced version of it.
Right. Right.
So
I love that so much. Thank you for saying that so just eloquently and almost plainly, of just oh, this is just, you don't get that perspective so much. And I think it's of the most important ones to have, especially today. It's so volatile. Yeah.
I mean, here's the thing, and again, this is partially it's because, our overall healthcare philosophy in this country, and in the West is very much focused on disease treatment instead of health promotion. But if we talk about chiropractic influencing, right, by correcting the spine and reducing tension within the nervous system, it allows the body to better regulate and coordinate function. It's a lot easier of a conversation than, oh yeah, if your child has ear infections, you should bring them in and get them adjusted. That simplicity in that conversation undermines our credibility and undermines the true effect that we have on the world.
Yeah.
In the same context as oh, Dalton, you mentioned oh, I was breech and, my uncle adjusted my mom and I turned on the table. Yeah, that happens. And we have to clarify that chiropractic is not about turning a breech baby. It's about restoring the neurobiomechanical dysfunction that interferes with baby's ability to move and get into an ideal position for birth.
Right.
And that distinction is incredibly important. And I think the nuance in there helps make it digestible for people who, typically only view things in the realm of disease treatment.
Yeah, it's true. It's true.
Yeah.
Well, it's been such an incredible podcast. Hey, we got Akeem, brother. Good morning, battle buddy. Love you, man, Peterson. Thanks for joining in, brother. Well, reach out to me after this. But before we go, I would love to just give you the stage to be able to. Oh, wait.
What?
Bella, so there's two things left.
Okay.
Bella, go the question that we
Yes.
ask everybody, and then after, we'll want to give you some time to tell us what your next moves are and how we can do that. But go for it.
Okay, so just as a fun little thing, because the name of the podcast is the chiropractic message. I just like to pose the question to the chiropractors that we have on to define the chiropractic message in your own words.
Define the chiropractic message. Your body is more intelligent and more powerful than you even realize. And if we can help you better adapt to the physical, chemical, and emotional stresses that you've accumulated throughout your life and continue to face for the rest of your life, it will allow you to more fully experience and more fully contribute to the world to make it better for everyone, yourself included.
It's true.
Perfect.
It's true. It's true. That's
Just
solid.
like put it on a poster board now.
Yeah, exactly. That's awesome. Well, how can we help you in your endeavors and missions? You know, you're teaching people all over about pediatrics. I don't know if what can help you.
So, here's the thing. My practice is fine. I get to serve my community. I love it. Like it's what I really, so whenever I do like a podcast or any sort of event, it's like, don't worry, you don't have to include my website or any of that. The thing that I'm really committed to is making chiropractic available at every birth for every parent and every baby everywhere. And it's one of the reasons why I love, the International Chiropractic Pediatric Association, because it's a nonprofit. It's the largest organization in chiropractic. And it's a nonprofit that's focused on training chiropractors, educating the public, and performing research on the true effects that we have in pregnancy in pediatric populations. And whether you want to work with families, whether you want to serve families in your practice, if you believe that chiropractic should be available for those populations, that chiropractic should be available for every man, woman, and child on the planet, that chiropractic should be available at births, that chiropractic should be available for these kids and these expectant moms who so desperately need us, then the ICPA is an organization you should support, that you should join. Together, that's how we're going to be able to transform the world. We can't do it one spine at a time, in our own practices. We have to do it on a larger level, and we need the entire profession to be motivated together to be able to make that possible. So the ICPA is really the place that I want the entire profession to be able to come together and say, yep, this is what we believe. This is what we stand for. A world free of subluxation, a world adapting and experiencing the world fully, a world where, kids can grow up experiencing and adapting fully without being in this chronic like fight or flight survival state. And that's what the ICPA has been committed to making possible for the last 40 years. That's why I'm so proud to represent them. It's why I'm so proud to teach for them. And it's one of those organizations that I think rightly deserves the support that it gets because of everything that it's been committed to doing for the world and for the profession as a whole.
That's so cool. So how does somebody start to get involved? Maybe is there a way for just like a civilian, a regular person to be involved? Is there a way for a student to be involved? And then is there a way for a chiropractor to be involved? How does that work?
So if you're just a general member of the public, check out the ICPA website. It's ICPA, the number 4kids.com. And find an ICPA chiropractor near you and get your family under care. See what it's really about. see, the benefits that are possible. I used to tell people, and I know I'm dating myself, but before high definition TV came out, we used to look at standard definition television and think that this was like the peak of entertainment. And then all of a sudden high definition came out and it's like, oh my gosh, look what's possible. I can never go back to living, to watching TV in standard definition. Like that's garbage. I can never go back to that.
Yeah.
Most families live their life in standard definition. And being well adjusted allows them to tap into that HD signal, allows them to experience the world more fully. And I think that's something that until you do it, you don't really know how you can benefit and how it's going to change your life.
Yeah.
So yeah, find somebody. And then there's also Pathways to Family Wellness magazine that they put out and, share really incredible articles about conscious parenting and conscious lifestyle. So that's typically available both digitally and in print. It's a great quarterly magazine. Couldn't recommend it enough. Awesome. For chiropractic students, develop a firm, understanding of the philosophy, science, and art of chiropractic. And really explore all aspects of the profession and see what resonates with you. And if you're, you're inspired to serve these populations, right? Expectant families and young children, start with like the Webster Technique certification through the ICPA, and then consider like continuing your education after you graduate, because there's so much more to learn, after you get out. And then if you're already in practice, do the same, right? Learn more, serve bigger. And, together, that's how we're going to be able to change the world.
Absolutely. That's incredible. Well, I appreciate you so much for taking the time on a Friday to come out and be on the podcast. We'll definitely have it all edited up at the end of the week. We got some really great podcasts coming out, and I'd love to connect with you more with who else would be a great fit for the podcast. And if we could just refer each other to keep spreading the message, that would be incredible.
Absolutely. I've got a bunch of names of great people for you to interview.
Awesome. Well, I'll email later then for sure. And it'd be cool. Yeah, absolutely. Well, Dalton, Bella, thank you so much for having me and including me. And, thank you for, as Sid Williams used to say, I love you because you love the things that I love. It's true. It's true. All right, brother. Well, thank you so much. Absolutely. Have a fantastic day. You too. Everybody. Let's see. I know. Okay. All right. All right. So here we are. We got it, guys. There's 32 of you still here. You got some questions for us? Let's talk about chiropractic. Let's do the review just for a sec. That was so cool.
That was so cool.
What do you think? Like, I don't know. It's just like, it's awesome to have chiropractors on this podcast. You know what I mean? Like, people who are out there changing the world. Like, I didn't know so much about the babies. And that study about how if you make the baby happy, the mama is happy. Well, that's so cool.
Connected.
So connected.
So connected.
So connected. It's freaking awesome.
Yeah, I feel like I am given such a strangely special opportunity to have one-on-one access to like all of these chiropractors that we're having on the show, just like as I'm beginning to explore the field, is very cool.
It's so cool.
To just like ask the questions that I'm like, what?
I know. It's cool. It's freaking awesome. And then the more you know, like you see all these incredible people like Dr. Ian, he was just like crushing it and helping create such a massive movement for families to use chiropractic as their healthcare system.
I know, it's awesome.
I mean, this is awesome. We got to do more. We got to get, I was thinking during this time, it'd be cool to get like a room full of chiropractors. Like if we go, all right, how do we get 10 chiropractors into a room and pose like a giant question, and then everybody just gets to ask what it is that they want to know.
Yeah.
Or like, how do we get chiropractors onto a stage and the public, like you guys get to come out and just ask, what is it that's going on with your health, or people that you know? Like, who do you guys know that has allergies? Who do you know that wants to have a baby? Who do you know that's had miscarriages? Who do you know that has children even, you know? Maybe it's you. Like maybe you want to have a healthier family. Just because they're not toddlers doesn't mean, hey, if you got a spine, you can go to a chiropractor and your life will be better. It's the truth. The truth.
I just love that conversation so much. I appreciate, because I'm such a philosophy person, like speaking to such, like, I mean, I don't know the name of the certification, but that he, like, from Life University, like the philosophy award or whatever, like that was really special to me to just like get into that a bit.
Yeah.
Yeah.
It's so cool. Well, guys, here's the deal. This week, we have a bank of podcasts that are coming out. We've got we have Nurse Kennedy Davis.
That's a good one.
That's incredible. She's a hospice nurse. She was an emergency room nurse. She's incredible. We have my cousin, Christian Graham.
Oh, that one's really good too.
That was so incredible. That one's a long one. It's like 3 or 4 hours or something. It was incredible.
Interesting.
Yeah. He works in Alaska. He's a teacher for an Inuit tribe. And man, that one is so cool. I mean, we just go off a million different topics. It's freaking great. But by the end, it's like you feel so empowered and incredible and just happy that you're living in the world that you live in. And then we have 2 Dr. Brian Downs. Yes. Last time we did a live, we had like 40 people on, and we just talked about what chiropractic is. So if you've been loving this one, you're going to check that out. I had finals where I'm in chiropractic school. So I had finals for like the last 2 weeks. So I totally was slacking on editing that stuff. Yeah. So for you guys that don't know, I'm in chiropractic school where you did business school. It was rough, but we made it. Now we're going to make carne asada, French fries.
Okay.
Right, grass-fed, organic, just so you know it's not terrible for you for breakfast. But shameless plug about the Sovereign Architect.
Yes.
Come on, guys. Here's the deal. I've been also not putting it out as best as I could, but that's different. In this very moment, if you don't know what the Sovereign Architect is, it is a system to help remove all of the crap that has been absorbed in our minds from media, maybe your parents, maybe your friends, maybe whatever it is that you think about the world. You're able to let go of what you have been told you have to be, to remember who you truly are. It is a way to connect back to peace and love and understanding. You can check it out on daltonrios.com. You can give me a call. You can make an appointment. We are accepting a few more people into the program now, like maybe 3 or 4, depending on if this one person is accepting or not. We got like 4 slots open for one-on-one coaching, and we can help you turn your life around. We got one, my brother, Rich, is going through it. Richard, if you're on here, hello. We just started doing 25 push-ups, sit-ups, squats, and glute bridges every day. And now his kids are doing it. Bella and I are doing it. We call every day. We're going to be doing live streams to get that started. Rich is now, we're both combat veterans, so we'll be dipping into the veteran community and just providing a space where we can get up and do 3 to 5 minutes of exercising every day. And it'll help you change your life. We'll be doing some live seminars. We got one April 24th and 25th in Newport Beach, California. We are representing Grant Cardone because we're 10X business coaches. If you don't know, you can look them up. But we're doing a seminar on a 10X super life. What that means is just we're setting goals. We're taking off the limiting beliefs. We're breaking the ceiling, guys. We're going to show you how to imagine the life that has no limits for yourself, for your family, for your wealth, for your purpose, for your health. All of these things we are going to be covering in Newport Beach. We've got other podcasts working in the mix. We got some secret guests coming on, but stay tuned, guys, because we got some incredible things coming for you. Free stuff. We got some opportunities. We are growing our team here. Y'all gonna see lots of me more. So we love the interactions, and we'd love to know what it is that you guys are looking to understand, whether it's about chiropractic, whether it's about setting incredible goals. I got free daily affirmations. If you want free daily affirmations, DM me. It'll be like 4 months to reset all the things that you're telling yourself that could be holding you back from the life that you want. All right? Just reach out, guys. I got stuff for you. We can make it work.
Yes.
Okay? So we got 33 people left. Love y'all. See you on the next one. Dun, dun, dun. All right, here we go. Bye.
Bye.